Now we're recording.
Good morning. Welcome to Measure What Matters, KPIs that tell your story. As Jen said, I'm Brad Kain, co-founder and CEO of Salus. I'm really pleased to have Stephanie Shanler as my co-presenter today. And our goal is to share some of our understanding of key process indicators and maybe more importantly, some practical input on how you might implement these ideas in your organization. Just as background, I'm a technologist and have led a team that has designed, built, and supported a case and incident management platform for our partner UNICEF since 2014. We now support over 20,000 caseworkers, both globally and here in the US, in a really broad range of functions, child and family services, support for returning citizens, domestic and sexual violence prevention, workforce development, prenatal care for expectant mothers. Really a fascinating and broad range of ways in which organizations deliver on their missions. KPIs are incredibly important to us because case management is at the point of care, point of service, and the tools that are available to people really help shape the data that they can collect and can report on, and is really intrinsic to our understanding of our mission, which is providing better tools for hopefully better outcomes for individuals and families. So I'm going to sort of set the table today, talk a little bit about indicators generally and key process indicators, and they're really just measurements. What makes certain indicators key, I think, is how well aligned they are to the specific mission of your organization, which, sort of given how I talked about my background, can be a very broad range of programs or activities. Stephanie and I have worked a lot in child protection over the last decade plus together. So some of our examples are from that space, but we're going to try and, of course, match that or map that into the broader concerns of folks on this call. So after I do that, Stephanie is going to take over and talk about some of the specific challenges for defining and collecting measurements of outcomes, which is, I think, a particularly important area, and then share some conceptual tools and other frameworks that might help you implement them. Why should an organization measure at all? I think that there's really two main drivers. The first is accountability. Is your staff doing a good job? Are they being responsive? Are they acting in a timely manner? Or are there gaps in how they approach their mission? Perhaps those gaps can be closed, and that brings us to decision making because you can use indicators and key process indicators to decide what resources you need, how you deploy them, how you structure them, maybe the training that they've received, and can help improve your organization. An idea for how to define good indicators is this acronym of SMART. It actually comes from outside of human services, but it's, I think, a very handy way to focus the discussion around what you should be measuring. And specifically, you might have 10, 20 or more pieces of information or data that you're collecting, but typically only two or three or four are going to be truly key process indicators that are closely aligned to the goals of your organization. So ways to do that are to use the SMART test. Are they specific? Are they looking at a particular area of your process, particular way in which you deliver services? Are they measurable and attainable? I think these are sort of refinements of that specific characteristic. Relevance, I think, speaks to whether you've thought through the goals. Many organizations will start from the goals that they have as an organization and then drill down into the KPIs that they want to be tracking. But it's often a process of thinking through both sides of overall goals and how you're measuring them and coming up with those really key indicators of the kind of job that you're doing. The last one I think is probably the most overlooked one, and that's that they need to be time-based. Many organizations use certain metrics, maybe in a marketing context, that are interesting and emotive, such as, say, the number of constituents served or number of people housed, or et cetera. These are valuable, of course, but they don't really tell you that much about how the organization is functioning, and doesn't really help you identify gaps or other things to improve your decision making. So perhaps a role at the high level, but maybe not in the sense that we're trying to define key process indicators here. Now, taking the next level of detail here, you can look at process, outputs, impact, or outcomes. Process is generally a measure of the efficiency or the use of resources. Uh, Closer related might be outputs, but are more specifically around the specific things that your organization has produced in its process, maybe in terms of the timeliness or the completeness of care plans or assessments, could be looked at as a measurement of outputs. Impact we won't talk too much about today, simply because while valuable, they're looking at the net effect on a population that you're trying to serve. The specific ways in which you might collect information or measure that tend to be different. They tend to be surveys or statistical tools, whereas outcome-based measurement is really the effect that you have had with individuals, families, or that direct recipient or client of your services. I have two examples here from the Salus platform. The first one is a really quantitative measure looking at the successful referrals. I would consider this a measurement of your process because you're looking at, did your caseworker in these cases connect your client to the right service provider? Did they eventually provide a service? That's what's considered successful in this context. And if you're looking at it over 3 years, as shown in the example, then you have an idea of whether your organization is getting better at this process, or if there are gaps that are in fact opening up that might need to be addressed. The second example I have here is a qualitative measurement. And this is a percentage improvement in the psychosocial well-being. It has been reduced to a number, and I think that that's important to recognize that there's this duality of it's a judgment, right? It's collected with specific methodology and maybe with specific questions or approach, and involves people's reactions, right? But it has been reduced to a number here for reporting. There are also narrative and qualitative metrics. They're just not as interesting to show on a slide like this, and maybe a little bit harder to communicate in the broader case to a donor or funder or your contracted client. So again, both quantitative and qualitative metrics are supportable in any tool, not just Salus. And I think that the design and the thinking is the most important, that sort of leads us to these as outcomes, as ability to report on these kinds of indicators. So with that, I'm going to turn it over to Stephanie. She can introduce herself and then take you through the topics that she wanted to drill down on.
Good morning, everyone, and good afternoon if there's anybody already in an afternoon time zone somewhere. My name is Stephanie. I am coming at you from rural Maine, where we are also preparing for this snowmageddon, ice-mageddon that's about to inundate the United States. I am a 22-year veteran of the humanitarian system. I guess I would say I'm semi-retired. I left UNICEF in 2024, but I've also worked for the High Commissioner for Refugees. And then I have also INGO, International Non-Governmental Organization experience. I am in the UN system. I was what was known as a child protection specialist, and largely working in humanitarian contexts, less so in the development space. And as such, that's my experience is refugee camps, my experience is migration, my experience is unaccompanied separated children, children in armed conflict, and the tools that come with that whole population. Um, That said, even though I come out of the humanitarian space, a lot of the challenges and constraints that we have in the humanitarian space are challenges and constraints that we have in development contexts and in first world contexts. And when I use that nomenclature, I'm talking about the United States, Canada, Scotland, and New Zealand, places that have legally bound, um, well-staffed. I don't want to say so much well financed because we've got shrinking fiscal space across the board and a lot of social services. But a lot of the challenges that you have in the humanitarian space, you have in other parts of the world. And a lot of folks, automatically gravitate to, well, if it's a humanitarian tool, what use is it for me? And I said, there's a lot of usefulness that can come out of the humanitarian space, which is staffing constrained, resource constrained, transient populations that can be used in our in other contexts in the United States, in Canada, in places where you've got small towns or small systems that may be equally resource constraints. So the humanitarian community and the UN in particular are really good at with quantitative indicators. Almost every UN report that you read or every report coming out of the humanitarian space has X number of children served, X number of children attending child-friendly spaces, X number of unaccompanied separated children. Where it gets a little challenging is in measuring the qualitative. And this is true regardless of what setting you're in, development context, developed context, or humanitarian context. And when we're talking about qualitative, we're talking about KPIs that measure the effectiveness and the impact of your intervention, not necessarily the one that measures the number of cases that have been closed, the number of referrals, the timeliness of the response. And so when we're talking about qualitative, what we're really talking about is measuring the distance traveled. And when I talk about distance traveled, we're talking about how far a child is moved from their initial risk state towards a state of stability and well-being. We're also talking about measuring the why and the how. And when I talk about the why and the how, we're talking about how you capture the child's lived experience and the quality of the relationship between the caseworker and the child, the caseworker and the family. And you're also talking about getting a holistic view of where the child is and where the child is at the beginning and at other moments of time. And this is whether or not the child is moving towards a state of well-being. Is the child safer? Is the child happier? Not just whether or not the case is closed. Next slide, please. Okay. And there are, as I said, there are a lot of challenges with this, and these challenges exist across the board no matter what setting. And one of the first challenges of integrating a qualitative metric into your KPIs to produce a narrative that shows not just new numbers, but quality of care provided is around subjectivity and perspective. And I'll give you an example. Some caseworkers may perceive well-being differently than others. I've been in contexts before where a social worker in a humanitarian setting has said to me, well, the child smiled today. The child must be doing better. And you think, well, no, that just means that the child smiled today. How do we know that the child is doing better? What kind of questions did you put towards the child to find out how they are doing? And we'll get to tools that allow workers in those environments to determine the quality of the child's experience. But in addition to the subjectivity of whether or not a child's well-being is improved, you've also got from whose perspective. And a lot of the original qualitative indicators that were developed in the humanitarian space were really service-driven indicators. So it was whether or not the social worker was doing a better job, whether or not the caseworker was doing a better job. Big question is, well, how does the child or the family participate in setting the goals? Whose perspective of whether or not the case is, whether or not the child is doing better is being taken? Is it the professional or the caseworker? Or does the child think that they're doing better? Or does the family think the child is doing better? And then you've got issues of time intensity. It takes a lot of time to assess the qualitative elements of case of case management. And it's an iterative process, and it has to be done with a degree of frequency that requires personnel, supervision, and monetary. There has to be fiscal space in order to do this, which is why a lot of times in the humanitarian space, agencies are relegated to checking boxes or gathering data from the Child Protection Information Management System and other quantitative data collection um, platforms. So it is time intensive. And then you've got standardization gaps. And unlike mortality rates, there's no real global standard for measuring a child's sense of belonging or dignity. The concept of quality is nuanced, and the concept of the child's internal sense of safety also may change from culture to culture, context to context. And then we've got child development factors. And this is children under the age of 10, for example, often lack the cognitive ability to express abstract concepts like I am satisfied today, which requires specialized interviewing techniques. And finally, in addition to all of those challenges, you've got the challenges that are unique to working in the humanitarian space. And this is, do you have enough money? Do you have program continuity? Do you have staffing constraints? Do you have supervision in place? And for example, the Child Protection Minimum Standards for Humanitarian Action recommend that you have one social worker for every 25 children. Well, if you're dealing with a population of 60,000 children, of whom one-third need assistance, you do the math on that, and you can see that it takes a lot of social workers or a lot of certified caseworkers to be able to meet that particular ratio requirement. Um, there's also there are also, I want to say accusations, but there's also an awareness within the humanitarian space that a lot of the tools that have been developed in the context of case management for measuring qualitative service delivery or the quality of service delivery are actually Western centric. And so a lot of questions about, does the concept of well-being translate into other languages and other cultures? What other words need to be translated so that they are understood in other cultures? And how do tools need to be adapted so that they are language relevant and culturally relevant? And then, of course, in the humanitarian space, you're also dealing with transients. And so the populations, unless you're living in a refugee camp in which you have 20-year longitudinal ability, of which there are camps in the world where this does exist, but don't have the financial space in order to do this longitudinal assessment, you may be working with a transient population. So a child who arrives in Marseille may not be there 2 weeks later. They may have moved on to another location. And so there are challenges with transients. And then you've got your general programmatic challenges. And this is just a reality of working in the space. So you may have a beautiful program set up for children, working specifically with children who have a specific diagnosis, but then you may not have a program set up for parents. And so here you are doing all of this work with this child, but then the child is returning to an environment in which the parents may not be equipped with the same tools that the child has now been given to deal with the child's particular issue. So those are just some examples of the challenges that you may face just in terms of carrying out qualitative assessments. Next slide, please. Yeah. And this is just an example framework. I think it's fairly straightforward. But for example, the metrics in a humanitarian setting, if you go down to the last line, may be different than in a non-humanitarian setting. So you're really looking at a metric where the child feels safe in a camp environment versus assessing the quality of the parent-child bond, and then looking at specific and thorough evidence-based therapeutic models that may require more comprehensive care than a refugee camp social worker may be trained to provide. Next slide, please. So in terms of frameworks and tools, there are lots of tools to draw from. In the United States and in New Zealand and Canada, you've got national associations of social welfare that produce their own tools and very comprehensive tools. And towards the end of the presentation, I have an example of how Standard 9 of the National Association of Social Workers in the United States assesses their quality metrics. But you do have tools in the humanitarian space. And for those of you working in the United States who are interested in exploring what's available in the humanitarian space, it's really the first three, maybe four on this list that are actually really worth looking at because they may help you adapt some of the more comprehensive tools that are used in the US context to more simplified formats, especially for children under the age of 10. Um, Next slide, please. Yeah. So, as I said, there are a lot of challenges of working in the humanitarian space, and because of the fiscal constraints, the staffing constraints, the ratio constraints, and the way data is collected, a lot of tools are translated or transferred into visuals. And so one of the most popular visual to use with a child and with family, with adults, is actually the well-being wheel. And this is something that the International Rescue Committee has been working with the Alliance for Child Protection and Humanitarian Action. And this has been used throughout the world, and it's a very straightforward process. It's an emoji-driven process, and it's something that's easy to administer, and it allows you to take a look, if this is administered every week or every 6 weeks, it allows you to track whether or not the child is feeling better about the services that are being delivered to that child, whether or not the child is feeling better about their circumstances, whether or not there is some kind of proxy indicator towards well-being. In addition to the well-being wheel, we also have what's known as Cantrell's ladder. And Cantrell's ladder is something that UNICEF has used with its partners in a variety of settings. And it's exactly that. It's a ladder. And people mark where they are on the ladder in terms how they are feeling. And what these allow you to do is to gauge visually over a period of time perceptions of safety. Questions around caseworker competency can also be asked of families. Do you feel that you are benefiting from your caseworker visits? And then, you either are, you aren't, or you're lukewarm about it, but it falls on that ladder. Um, and then you've got feedback tools that can be integrated into, it's known as accountability to affected populations in the humanitarian space. So for every program, there's supposed to be a feedback mechanism for community to let service providers know whether or not they're benefiting and what changes they would make. And then you have structured observation checklists, which are used in a lot of child-friendly spaces. Just a note on child-friendly spaces, they are a unique tool in the humanitarian space. In the context of it provides a safe space for children of all ages, technically, to receive support and protection. But they're quite controversial because in a lot of settings, they've been used more for daycare and they have not necessarily been staffed with competent protection personnel. And so that said, the standards for child-friendly spaces and the observational checklists, if the child-friendly space is set up as a protection function, these are very valuable tools and can be used to train service providers who have the responsibility of overseeing a large group of children at any given moment. Next slide. And so this is an example. So I've showed you the well-being wheel and I've showed you Cantrell's ladder. And this is just an example to show how much more in-depth the National Association of Social Workers shows you can go with your qualitative assessment process. And so, for example, Social Worker Case Management Standard 9 in the United States, or the National Association of Social Welfare Officers, they've got effectiveness indicators for the patient and they've got effectiveness indicators for the service providers. And because of the way the continuity of care takes place in the United States, sometimes, by the way, under the auspices of a legal requirement, these types of questions and this type of in-depth questioning allows states and allows service providers to determine, whether or not the patient, the client, is receiving the type of care mandated, but it also allows for an assessment of whether or not supervision is effective, whether or not the care in question is even meeting its objectives. It's just much more comprehensive. And these types of narratives, and in the United States, and for people who have been working in the United States, I came out of the juvenile justice sector. You're able to see very, very detailed notes about how your client is doing, and it allows you as a supervising attorney or allows you as a juvenile advocate to be able to make recommendations to the court. This is something that I wish this is something that would be available in the humanitarian setting, but unfortunately, we're just not in a situation yet where this type of comprehensive analysis can be undertaken. That said, we still have the well-being wheels and the Cantrell's ladder. And I think I think I've got one more slide on journals and references, but I think that and some additional citations. Yeah, I think that's it. That's it for me. That's it for me.
Outstanding, Stephanie.
Sorry, I got in the weeds there on the last one. Because there are things that we can do in the United States that I would love to see done in a humanitarian or development context, but the resources and the staffing are just not there yet. And there are a couple of countries in the world that have experienced repeated crises that have been able to do some of these longitudinal studies, like in Myanmar, for example, IRC in Myanmar, and in Jordan, UNICEF did an evaluation of its care paradigm with the Jordanians from 2013 to 2017. But we just don't have the same examples that we do here in the US and in Canada. No, I'm done.
Thank you, Stephanie. That was awesome. Let's throw it open for some questions if folks have. Do you have them there?
I do. I have a couple of questions here. Um, Here we go. How can organizations use KPIs like as a learning tool? Something teams actually review and act on rather than something that only lives in funder reports.
Stephanie, can you address that?
This is the lessons learned. I think that this it's complicated from the standpoint in the sense that you need the staffing and you need the money to be able to do this. But if you have the staffing and the money in place, I mean, I've seen programs, especially in the Jordanian context, I've seen once the staffing and the money is in place, and you've got folks that are assigned regularly to review and to take a look at the narratives and to provide feedback mechanisms to the social workers. You can create a culture in which it becomes normal, part of the normal course of business. And I have two actually practical examples. So earlier, when it was last year I worked with Brad and his team and with the UNICEF folks to take a look at how China and Ukraine were using the child protection information management systems in their particular humanitarian contexts. And as I said before, a lot of the focus is on quantitative at the outset. But the social workers I talked to in both China and in the Ukraine all came back and said that even using the tool in and of itself made them better social workers because they had to think differently about the questions that they were going to ask in light of the type of quantitative information that was being asked. And they felt like they were spending more time on relevant questions and feedback with the families than they were just on checking boxes. I don't know if that makes sense to you, but for the Chinese and the Ukrainian social workers, having a tool that guided them on the types of questions that they could ask or should ask really helped them think about how they were asking the question, what the quality of the feedback they were getting, and what kind of follow-up questions that they had to ask. It's not impossible. I think it just requires sometimes thinking differently about the tool that you have, but it also requires staffing and resources.
I think it's a fascinating point, Stephanie, because in the long arc of us working together, we've introduced a tool where there often has not been one before, right?
Yeah.
In many of these
Yeah.
contexts, right? I think we've probably replaced Excel, more than
Yeah.
any other specific tool, right?
Yeah.
And one of the consistent things that we've heard back from mostly UNICEF, but also IRC and SAVE, and now here in the US teams, that when you have a tool, it has this effect on the process,
Yeah.
right? In that you're spreading best practices, sometimes in a staff that has had different ways of doing things individually, but you promulgate some consistency, and
Mhm.
it seems to have an overarching effect in terms of time spent with the beneficiaries and other clients,
Mhm.
as you were saying, questions asked,
Mhm.
and it just provides a much more rigorous sort of environment. And I think people respond well to that, the caseworkers in the field, right?
Yeah.
Because they haven't had that in the past.
Something else that was pivotal in both China and Ukraine, though, and this was brought forth by the managers of the information management system, is that they set up WhatsApp channels or signal channels. I can't remember what the name of the channel is in China that allowed for, they were confidential discussions. There were no names of children, but it allowed all of the social workers who were involved in rolling out the system to talk to each other a little bit about what they were encountering, both in terms of administering the tool, but also how it had changed the way they were engaging with families. They felt like having the ability to exchange information and talk openly about some of the challenges they had in work, kind of the gender bias issues that they had, some subjectivity issues that they had, also changed the way organizationally they operated in this space. It was no longer this very surgical, clinical, check the box exercise. It became very personalized to them.
Perfect. Another question we have here is, Stephanie, do you have any data on how widely used this type of KPI analysis is in the US context? Is this possible for smaller nonprofits?
Um, I would say that the this type of KPI analysis is I don't have an actual number for you, but I know there are certain legal requirements. There are certain legal requirements in place that require service providers to capture the narrative and to show progress. And so I would make an argument, at least where social workers, hospitals, judiciary, and law enforcement are concerned, that there is a natural tendency towards collecting qualitative KPIs. That said, we get into what is the quality of the qualitative KPIs. I mean, that's it's one thing to collect them, it's one thing to put the narrative in place. It's a whole different ball game. And I know this from when I used to practice, when you pick up the narrative from the social worker and it's incomplete or it's missing something. But I would say that it's more common than uncommon, at least in the US, at least in where it comes to juvenile advocacy in the courts.
I think this question kind of dovetails into the last two that you spoke of. When selecting, digital tools for KPI tracking, what capabilities matter most if the goal is storytelling and insights, not just data storage?
Mm. Well, I think in at least in the development and the humanitarian context, it's the ease of which the information can be entered into the system. I know that in Ukraine and China, they talked about the crush of paperwork being the limiting factor for how well they were able to do their jobs. And I know that digital solutions, a lot of people will say, if it's not working on paper, it's not going to work digitally. And in a lot of cases, that's not true. A digital solution in a place like China and Ukraine actually alleviated a lot of problems. Digital solution I know from my East Africa experience, also alleviated a lot of problems. Paperwork can be the death knell for efficiency. It's just too much detail asked and too much back and forth. Not to mention there are issues of client confidentiality and papers get lost.
So last question here, if an organization wanted to improve its KPIs right now, this year, that's their January goal, what's the first small step you'd recommend taking?
For me or for Brad?
I think it's for you, Stephanie.
Oh, wow. It's well, it starts with, what kind of organization is it and what kind of information are they collecting and for what purpose? Um, I would say that, the quantitative is important, but it really goes back. I don't know. I almost feel like this is a little bit, it's unique to whatever service is being provided. And in the US, there's a question of what the legal requirements are as well. Um, but I would say if you are only taking quantitative data now, take a look at the tools that are available within your particular thematic area, whether or not it's judicial, law enforcement, health, or social work, to see what qualitative indicators are what kind of qualitative information is being collected. That said, it sounds very clinical when I say that. You can do the quantitative, you can do the service-driven qualitative, but I think also not forgetting to talk to the client about what success means for the client. We talk about participatory approaches all the time in the humanitarian sector, and a lot of times I feel like it's a lot of lip service rather than really, really happening. But I also find that sometimes in the US also, we are very service oriented, and there's not a whole lot of client participation in terms of what success looks like for the client as well. So, in addition to taking a look at what your service sector requires, also, making a concerted effort to talk to your clients about how they see success. I don't know if that's helpful. I mean, one of the advantages of, how do I say advantages? Yeah, it is an advantage. One of the advantages of working in the United States, though, is that when you graduate with a degree and a professional degree, I mean, you are automatically thrown into an environment where there are certain expectations on the quality of your work, and there are certain expectations that service providers are going to share information. And so I think that if you are starting out, it's your default is to go to what the profession requires first.
Perfect.
That's
Outstanding. I think that was very informative, Stephanie. I really appreciate you joining us today to share your background. Any last questions from anyone in the group? I think we're all set. Outstanding. I want to thank everyone for joining us today. And Lori said in the chat, but we'll send the video recording of this out to all the participants and also the slides so that you can have access to this information. And always happy to address any follow-up questions via email. Thanks, everyone. Enjoy the Snowmageddon this weekend.
Yeah, everybody
Thanks
be
very much.
Thank you.
Thank you, Stephanie. Thanks, Brad.
It's an AI question. Yeah. All right.
You stopped it.